Hello, I'll be talking about challenging behaviors in individuals with autism spectrum disorder or ASD. So first I'll just talk about what challenging behaviors are. So challenging behaviors are behaviors that are harmful, whether that be to the individual themselves or to another person, such as a parent, caregiver, teacher. Behaviors that are destructive, behaviors that inhibit the ability to learn and participate in daily activities, and then behaviors that isolate the individual. So, for example, if a peer excludes the individual with ASD from different activities because of the behaviors that they're exhibiting. And I found a really good resource on Autism Speaks about challenging behaviors, and they listed some specific examples of different challenging behaviors. So I'll list a few of those for you to keep in mind as I go through the presentation. The first one was Susie screams every time she hears an airplane and is very hard to calm down. Tommy refuses to wear shoes and throws them at whoever is helping him put them on. Maria doesn't like riding the bus and bites her mom whenever she sees the bus coming. And then Sally hits herself in the head whenever anyone tells her no. So this next slide just shows the prevalence or how often challenging behaviors are seen in individuals with ASD. And I got this information from a couple of my textbooks. And so in one of my textbooks, it stated that challenging behavior has been reported in more than 90% of individuals with ASD. And then in the other textbook that I read information in, they looked at it a little bit differently and stated that 10 to 40% of individuals with disabilities display challenging behaviors, but they didn't look specifically at autism spectrum disorder. They looked at disabilities as a whole. However, they did state that problem behavior is 3 to 4 times more frequent in this population than in those without disabilities. So you can see that challenging behaviors are commonly seen in individuals with ASD. And this slide I think is very important to remember that behavior is a form of communication. So many individuals with ASD may voice their wants, needs, or concerns through behaviors rather than words. So trying to think about what is the individual trying to communicate through these behaviors. So you can think back to those examples that I gave at the beginning and try to think about what they might have been trying to communicate. So the example of the child throwing the shoes every time somebody tried to help him put them on, maybe the feeling of the shoes on his feet is too much sensory input, and maybe that's his way of showing that is through that behavior. So I think that this is a really important takeaway to keep in mind, that behavior is a form of communication. So this slide shows a chart that shows some of the different reasons that individuals might display these challenging behaviors, so whether they want to obtain something or avoid something. And you can also think back to those examples that I gave at the beginning as I read through these lists. But some behaviors that individuals might display could be to obtain attention or a reaction, a tangible item. Maybe they want a specific activity, reinforcement, or they want to obtain sensory stimulation. And then on the flip side, maybe they're trying to either avoid or escape work, sensory overload, transitions, social situations, or sensory stimulation, which you can see the individual might be trying to obtain or avoid sensory stimulation. And then this slide just lists some important things to remember for individuals that either work or are around individuals with challenging behaviors. So first, it's important to remain calm. How we respond to actions can have a direct correlation to how the individual with ASD might react the next time. Many behaviors are responses to previous experiences. It's important to follow a plan if there's one in place. Avoid visual frustration. facial expressions or vocal expressions can show frustration. You want to make sure everyone is safe, and then try to move on from the incident and not let it carry over into the next activity. And then this slide just shows a take-home component that I put together, and this is applied behavior analysis, which is a common therapeutic intervention for individuals with ASD. So I just listed some different facts and information about ABA therapy. And then at the bottom, I listed a couple places in the Fargo-Moorhead area that provide ABA therapy, so Pediatric Partners and the North Dakota Autism Center. But this is just one treatment technique. There are other options if you've tried ABA and it didn't work, or if you just want other ideas. You can think about occupational therapy and sensory needs. So if the individual with ASD has different sensory needs, maybe an occupational therapist would be beneficial, or even speech therapy. Assistive technology might help the individual communicate their wants and needs in a different way from these behaviors that they are exhibiting. But this chart just kind of shows different information about ABA therapy. And then this slide shows my references that I used for this presentation. Thank you for watching.